Hello everyone, it's Dr. Atkinson. Today we're covering nasal obstruction, one of the most common reasons patients experience chronic nasal congestion. Nasal obstruction happens when the airflow through the nostrils is blocked. This can be caused by a deviation of the nasal septum, hypertrophy of the turbinate bones, or the presence of nasal polyps. When the nose is blocked long-term, patients often resort to mouth breathing, which leads to problems like persistent dryness of the mouth and cracked lips. They may also struggle with sleep deprivation because it's difficult to maintain a clear airway when lying flat at night. Persistent nasal obstruction can also set the stage for chronic infections. It may lead to repeated episodes of nasopharyngitis, and if the infection spreads, it can involve the sinuses. When drainage from the sinuses is obstructed, patients may develop rhinosinusitis, often with pain in the affected sinus area. Medical management treatment depends on removing the obstruction and managing any underlying infection or allergy. Non-surgical management may include nasal corticosteroids used for 1 to 3 months, especially helpful for small polyps. Oral leukotriene inhibitors, such as montelukast. A short course of oral corticosteroids like prednisone, especially for polyps. Antibiotics if infection is present. Antihistamines for allergy control. Astringent agents to shrink hypertrophied turbinates. If these measures don't work, surgery may be needed. Surgical options are grouped under functional rhinoplasty, procedures aimed at reconstructing and reshaping the nasal structures to restore airflow. With newer techniques, there are now many safe and effective surgical options available. Nursing management. When surgery is required, it's usually done on an outpatient basis. Nurses play a key role in both pre-op teaching and post-op care. After surgery, the head of the bed is elevated to reduce swelling and promote drainage. Because patients often have to breathe through their mouths temporarily, we encourage frequent oral hygiene to manage dryness. Before discharge, patients are taught to avoid forceful nose blowing during recovery. We also review warning signs of complications, such as bleeding or infection, and explain when to contact the provider. Written post-operative instructions, including emergency numbers, are always provided. That's our overview of nasal obstruction. Remember, management is about addressing the blockage, treating any infection or allergy, and supporting patients through the recovery process if surgery is needed.